With over 150 combined years of healthcare legal expertise, Florida Healthcare Law Firm was built for your protection and success. We represent healthcare professionals and businesses of all kinds, treating our clients with warmth, transparency, and respect. From regulatory compliance to mergers, acquisitions, and business transactions. Discover all we do at floridahealthcarelawfirm.com.
Ever walked out of a lawyer's office more confused than when you went in? Our goal at Florida Healthcare Law Firm is to make sure you understand the law, the options, and the risks, and find the right business solution for you or your business. People ask us all the time what we do. The simplest way to describe it is that we make people money, save them money, and keep them safe. It all starts with a free initial 15-minute consultation. Please stay on the line to arrange yours.
Nearly every business agreement in healthcare is regulated by some state or federal law. Even simple-seeming agreements like leases are regulated. Did you know it's illegal for a healthcare professional to receive payment for certain things? Marketing agreements are the
Good afternoon. Sorry about that. I was slight technical problem. Okay, my name is Stephen Boyne. I'm an attorney with the Florida Healthcare Law Firm. I have a background primarily representing both providers and insurance companies. I've been practicing law for over 20 years and have dealt with many different issues. And as probably most of us know, right now, the COVID-19 is probably the most important item, an issue we may face in our careers. I want to take this time just to kind of quickly run through the government support dollars, but I do want to really stress the fact that there are some upcoming deadlines, specifically the application for the PPP. If you haven't applied for the PPP, the deadline for that is June the 30th. I'll touch on it again, but it's pretty easy to fill out the application. It's relatively easy to get the money, and it's relatively easy to spend the money in the correct way. So anyone who has not applied for it, they really should, because it's a tremendous assistance to corporations and individuals in this very trying time. Okay. As many of you know, COVID-19 has devastated the U.S. economy, including many parts of the healthcare sector. And both federal government and the states have come up with various incentives, grants, loans, and other things like this. I'm going to provide a pretty high-level overview of what's available, but part of it is a little bit of luck. Most of it's just filling out the paperwork correctly and checking the boxes, working with your accountant, especially if you need some assistance, and then hopefully you will be able to get the support, grants, and loans that you're entitled to. The CARES Act was passed a few months ago. and it has many different parts to it. It's also been updated recently. The first is the Emergency Economic Injury Disaster Loan. It's a $10,000 loan administered by the SBA. It's not administered by any of the banks. Pretty easy one-page application to fill out. They're still accepting applications. The money is basically, as long as you use it correctly, which is really for payroll and related office expenses, it becomes pretty much a grant. And if you apply for the PPP, the Payroll Protection Program loan / grant, whatever you've received under the EDIL loan will be put towards that. The SBA is pretty slow in administering it, and they have set restrictions on the basically the most you can receive is $1,000 per employee. So if you have 10 employees, the most you can receive is $10,000. If you have 20 employees, again, the most you can receive is $10,000. It's sort of the idea was to come up with a quick $10,000 / $1,000 per employee to provide additional assistance. So if you haven't applied for that, you really should go to the SBA. Easy to fill out. They tend to communicate via email, and you know, if you meet the criteria, which is not particularly difficult, you should be able to get that money. The more important is the Paycheck Protection. I'm sorry, I called it payroll. Paycheck Protection Program, the PPP. It's a grant. Basically, as long as you use it correctly, it covers payroll, employee benefits, rent, mortgage, utilities for 8 weeks. You initially had to spend the money within 8 weeks and spend it, I believe it was 75% on payroll. That now you actually have now 24 weeks to spend that money. So basically what you do is you take 8 weeks of your payroll, you apply for that, you add in when you fill out the application, depending on the bank, most of the bank's applications kind of do the automatic bump it up, and what they do is they add 25% to your 8-week payroll, and that's meant to cover, again, employee benefits, rent, mortgage, utilities, and those kind of things. So, for example, if you apply for $75,000, if you have $75,000 worth of payroll during an 8-week period, your application will end up being completed for $100,000. It's for small businesses. It's managed through the banks and financial institutions. It is not managed by the SBA. It's overseen by the SBA, but you're going to have to work with your bank. Initially, there's a lot of problems with various banks not processing the applications correctly, taking too long. But now I believe it's smoothed out pretty well. And even if your bank is no longer accepting applications, there's plenty of other companies and entities out there that will allow you to submit applications, and some of them are kind of almost like brokers, where they will submit applications to multiple financial institutions on behalf of you. As of today, there's still about $130 billion available, and so if you haven't applied for it, I strongly suggest you do apply for the PPP. Also, do not worry about if you apply to multiple financial institutions, because basically the way the process works on the back end is it's tied to your EIN or your Social Security number, whatever you used in your PPP application. Comes up with a unique number that's generated by the financial institution, and that's compared. That goes back to the SBA. So if you apply with Bank 1 and you also apply with Bank 2, whoever comes first will issue that will issue the money, and all of the other applications that you've got out there are basically automatically terminated. So do not worry about applying to multiple entities. If you do receive the money, you really need to keep excellent records, and I'll touch on that a little bit more, what's important and what's not. And bear in mind that you can only use it for W-2 employees, not for 1099 contractors, because 1099 contractors are able to apply on their own. So otherwise, they would have the ability to, in effect, double dip. The Paycheck Protection Program, it has kind of somewhat strict rules. So one of the rules they look at is the number of employees you had when you calculate it. And I believe it's February the 15th. However many number of employees that you had on that day, that's the date, that's the number of employees that that you would use as the basis for your calculation for the payroll. So let's assume you had 10 employees on February the 15th. Now, when you apply, let's assume you apply today, even if you only have 5 employees, you can still apply to 10 employees, and then you can spend the money. Now, if you have 10 employees on February the 15th, and you have 10 now, but you have different employees, that's okay too. It's just sort of the total number of employees. The other restriction is that you cannot, no employee can earn more than $100,000 a year. So to the extent that you, as the owner of the practice, are paying yourself more than $100,000, with respect to your application, you have to cap your base salary at $100,000. If you don't use all the money, you basically have to pay it back, or in a lump sum, and it will be in the documentation when you receive it from the bank of when the money is due, or you have the option. Originally, it had to be paid back in a couple of years. They recently extended it now for 5 years, and it's at 1% interest. So to the extent you don't use it, it still could be all of it. It can still be used as a pretty good loan, 5 years at 1%. The PPP also had additional benefits to various healthcare entities. Hospitals and sort of larger clinics are able to apply for basically a 6-month advanced lump sum payment, and it goes back and you look at the look in your past Medicare billings and what they were last year. You take 6 months of that, and you can apply for 6 months. In effect, it's not really a loan, it's just an advance. So to the extent that you need that money, that's important. HHS also has gone through, and if you, I know plenty of physicians didn't even realize. They just woke up one day and looked into their bank, and they had some of them had some pretty big checks in their bank accounts, and it came from United. United was the third-party administrator for the HHS, and basically the HHS provided additional grants to healthcare providers who provided Medicare or Medicaid services. If your practice does include a significant portion of Medicare or Medicaid services, and you have not received any sort of a grant out of the blue that was tagged by United, please contact me, because there's a way to appeal that, but you should have received those monies by then. Additional skilled nursing facilities, dentists, other providers who only treat Medicaid beneficiaries entitled to additional assistance and monies. The PPP has a special guidance and additional fundings for folks who are rural providers, and that's basically a definition by your address. And just because you may live in what you think is a county that is not rural, because they're a city, that you're working out of a city or whatever, it would behoove you, to the extent that you may have a satellite office or a second office in an alternate location that may appear to you to be somewhat rural. The suggestion is that you contact me, and I can guide you through how you can search by that address. And if your clinic is designated as being, or your practice is designated being in a rural area, there are additional monies available. And it runs the gamut from telehealth to computers to additional discounts on internet fees and charges. Now, if you've provided COVID-19 assistance to patients, there are additional grants available to the providers for the purchase of PPP, contact tracing, infection control, mitigation, even the temporary construction of facilities that you may have put up on the outside of your clinic. Or there are also pretty broad available grants for that. Again, going back, the factors that you need to consider when you apply for the PPP, it's definitely tied to the number of employees. There's also part of the CARES package that was passed in earlier this year and has been updated is there are some significant tax credits. And tax credits are very, very nice, and they really can benefit a lot of folks. The rules are somewhat complex on that, and I would suggest to the extent that you have an accountant, you need to go back and make sure that you've applied correctly for those items, because you can actually get tax credits up to $5,000 per employee. And the tax credit arise for folks who get sick from COVID-19, or they have to care for others who have COVID-19. Tax credits available for employees who need to leave for childcare. And there's a payroll tax deferral for any payments that are due in 2020. And there's also some tax credits for employee retention. Again, the rules are kind of complex and beyond the scope of today's presentation, but something that needs to be carefully considered, and you need to work with your accountant on that issue. There is a lot of other types of relief out there. Many states, local, and there are a lot of grants available and emergency loans from counties, cities, states, and the loans are small amounts all the way to rather large amounts. In effect, if you've been adversely affected by COVID-19, or you've had to change your practice based on COVID-19, it would behoove you to do some research. I'd be happy to help you out, but basically do some research on what other grants and emergency loans there are out there. Quite a few cities especially have provided small business loans to healthcare providers. FEMA, because it's been has been designated a disaster in all 50 states, has also been brought into play in providing funding and assistance for COVID-19. The FEMA programs really are mainly aimed at states, tribes, and not-for-profit organizations. So to the extent you're a for-profit organization, the most you may be able to get is some sort of a loan. But if you're looking for grants or substantial assistance, you really need to, from FEMA that is, you really need to be either a state, a tribe, or a not-for-profit organization. To the extent that you are part of any of those three groups, please contact me and I can provide some specific assistance in how to apply for those FEMA grants and loans. As many of you know, telehealth has really taken off in light of COVID-19. The burdensome regulations that many of the states, and especially the federal government through HHS, CMS, and a bunch of other folks have put on telehealth have really made it somewhat difficult. And now that those regulations have been substantially loosened, I have a feeling that those regulations will never go back in place. I think the genie's out of the bottle. So to the extent that you are not utilizing telehealth and you have some competitors who may be utilizing telehealth, I would suggest that you begin to understand and utilize that program. There are special new billing codes that have come up to allow you to bill for that telehealth. You don't even have to do it video. You can actually, telehealth includes telephone calls as well, and there's the ability to bill for those telephone calls now as well. made it much clearer. Everyone's beginning to accept that. There's also, to the extent you are back in you walk out of a rural area, there are pretty substantial grants for equipment, network and facility upgrades, and other items assistance that would assist you in telehealth. So the types of entities that are providing that kind of assistance are pretty broad, and you wouldn't even think about who they could be, but they would include both the FCC and the USDA. In addition, the Health Resources Services Administration, which is really sort of the federal entity that provides assistance to rural healthcare. They have grants, again, to underserved or rural areas, generally defined by where your zip code is and where your office is. The Universal Service Administrative Company, which is kind of a pseudo-federal company, they also have assistance. NIH has assistance, and various foundations have assistance. You may want to dig around to see if there's some available funding, but I think if you're based in a major city, you probably won't find telehealth assistance. If you live in a rural area, you will find a lot of it. And again, for everything from networking upgrades, computer purchasing, cameras, assistance in paying for high-speed broadband, it's pretty broad. It's pretty clear that the federal government wants to push telehealth to every part of the United States. Important updates to the, as of June the 5th, when that was the most recent update to the CARES Act. They've updated the application. Application is even if you've applied for it, I would still go back and print out the application, because it's actually clarified a lot of questions that came up for those of you who have applied and received a few months ago. Go ahead and get a copy of that. The deadline is June the 30th. So again, we are only less than a week away from the end of this month. And so to the extent that you have not applied for it, please go ahead and do it. You don't have to prove hardship. You now have 24 weeks to spend that money, and you only have to spend 60% of it towards payroll. But to be honest, if you've applied for the PPP and you filled out the paperwork correctly, and you have approximately the same number of employees today that you had back on February the 15th when you did your calculation for your gross payroll, you shouldn't have any problem spending all of the money. And if you can spend it on payroll and other items that I'll touch on in a minute, it will all be forgiven. They clarified the definition of rent. Rent now includes not only standard things like office rent, but it also includes equipment leases. So if you lease a copier, if you lease computers, if you lease furniture, those kind of things, that now is included in the definition of rent. If you have any other debt obligations, it's a little bit, the language is a little bit squirrely on that, but basically if you have other interest on debt, the sort of debts associated with your corporation, that is also covered under the PPP. Furthermore, utilities now are clarified: electricity, gas, water. Transportation is kind of unclear what that really means, but a lot of folks who provide any sort of transportation assistance, or perhaps who have not provided transportation assistance but are willing to provide transportation assistance to their employees, that would be a utility too. Telephone and internet access, all of that is a utility. Now, when the federal government has in effect outsourced the loan process and the auditing process to the financial institutions, and in return for that, the financial institutions who you applied for get a small percentage of the amount of the loan. So when you finished spending all of your money and you have in effect till the end of this year to spend the money. You will then have to fill out a bunch of forms that each financial institution is going to put together. Those forms are going to, in effect, require you to provide substantiation for what you've spent on payroll for your employees, on your utilities, on your rent, and other associated items. Now, who's going to be looking at that? Not the federal government. Employees of the bank are going to be looking at that. And they're going to probably be ultimately somewhat low-level employees. They're just going to have a checklist. They're going to check, did you submit this? Did you submit this piece of paper? Did you spend this kind of amount of money? What did you spend it on? So first thing is you need to keep copious records. The second item is make sure you fill out and submit perhaps more supporting document than less supporting document, because in general, if you have a clerk, a lower level clerk going through that, they're going to feel more comfortable signing off on it. Now, once the application has been approved and signed off, basically the financial institution is going to recommend. Now, I haven't seen what's going to ultimately happen because very few companies have completed and submitted they're only beginning to submit their paperwork in support of having the full amount, in effect, convert from being a loan to a grant. But my guess is they're going to probably, once you've submitted the paperwork and you've met the checklist that the bank has required, it's going to probably go up to the SBA for a quick approval, and then you should be approved, and your loan will become a grant, and you will, in effect, not have to pay that money back. The SBA still has the right to come in and audit you at some point. I believe it's going to be at least probably 5-year right to go back and audit you. So just because you got through that hoop doesn't mean that you may not have some liability in the future. The other item that I think is important, and it may or may not show up when you submit your paperwork to the financial institution, is as of today, and again, this may change again, but to the extent that you have utilized the funds to pay your employees, you cannot deduct those expenses. Otherwise, in effect, you would be double dipping, because you would be receiving the money, but also from a third party, which is a grant, i.e. the federal government, and you would also be deducting it. Now, there's been some talk in Congress that actually that was the intention of Congress, to allow you to double dip. So in other words, you will receive the money and you ought to pay your employees, even though you're paying the money with the federal government's funds, and you also get the right to deduct it. But as of today, you do not have the right to deduct that. Now, your accountant should be able to work with you on that, but just make sure that you're not double dipping, because that amount will be denied. Now, in return for that, you don't have to declare the quote-unquote income that you received from the federal government. So again, if they've issued you a grant of $100,000, that's not income to you, but it's also not, and you spent the $100,000 your employees. It's not income to you, and it's not deductible to your corporation either. So probably again, the most important: keep copious documents. Be responsive when it comes to the EDIL, going back to the SBA, and also the applications that you may have submitted with the federal with the banks. Again, there's only a few days to go, but do submit it, because it's a great program. It's worked for a lot of individuals, and it's helped a lot of healthcare entities make it through a very, very tough time. That completes my presentation. I know I set aside an hour. I wasn't sure how many people were going to be posing questions, but my goal was to put the presentation together for about 30 minutes, and I believe I've kind of met that. I'm looking online right now, so to the extent if you have any questions or whatever, please feel free to submit some questions now, and I'll kind of hold on for a couple more minutes, and if there's no questions, And if there are any questions, I'll read them out and then answer them. And if there's no more questions, please feel free to contact me in the future. I believe the number is on there. Yeah, it's 561-455-7700. My direct number is 561-666-6942. That's 561-666-6942. And my email address is Stephen@Florida Healthcare Law Firm. I don't see any, someone may have raised a hand. Will there be another PPP? Good question. I think it wouldn't surprise me if there is another PPP, to be honest, and I'll tell you why. Because you know, the first tranche of money went very, very quickly, and the second tranche of money has really not gone as quickly as possible. And I don't, and in fact, I've been somewhat surprised as I go talk to both healthcare entities and also other entities that have not submitted their applications for whatever reason. And there's 150 billion out there, so it wouldn't surprise me if it's available. The question is going to be available again to the folks who've already received the PPP. I don't know about that. I could see the PPP being extended, the deadline being extended, definitely. And it wouldn't surprise me if at the end of perhaps another extension for a month or two, if there's still significant money available, that they would then allow folks to perhaps amend their application to request more monies. Probably a combination of how the economy does, how the stock market does, and you know, whether or not the administration really feels like it's going to benefit them from perhaps a re-election perspective. Another question, since we have 24 weeks to spend the money on payroll, why worry about utilities, et cetera, on accounting? I agree. I wouldn't worry about it too much, but it's possible that you filled out the application for 10 employees and now you only have 5. So it may be difficult to spend all of that money. So the bottom line is spend the money on the payroll, folks. But also do the accounting on the utilities, because in effect, I think there's no harm in basically applying, basically submitting paperwork that you received hypothetically $100,000, but you spent $120,000 or $130,000. So to the extent that for whatever reason, some portion of payroll is denied or whatever, you still have enough room on the utility side to track it, because you're spending that money on utilities anyway. So it's really a matter of sort of getting with your accountant and making sure that you track that. So I guess the bottom line is belt and suspenders, track it, shouldn't be a big deal, and it may help you if there's some weird rule or weird interpretation comes down. There's nothing so far, but you know, what was in place for the PPP and the application and the paperwork was very different when it was initially passed in March than it is today, and it perhaps may change a little bit in the future as some of the requests for the waiver of the grants come in. So my recommendation is track it anyway. You never know. If we do have the PPP, do we still qualify for the $10,000 emergency economic injury? No, you don't. If you've received the PPP, then you don't qualify for that. In effect, basically, it was kind of the concept behind it was $10,000 up front, and then that will apply towards the PPP. So I guess if you did apply for it now, and they did send it to you, it would probably be calculated as being probably would be added onto your PPP, and probably would not be transferred over to a grant. So I would, if you haven't applied for it, I wouldn't apply for it. It's kind of unclear how they work. It's clear that if you get the EDIL, the $10,000 loan, and then you get the PPP, if you're entitled to, for example, a PPP loan of $100,000 and you've already received $10,000, then actually you're going to receive an additional $90,000 off $100,000. So they actually take that into account. The other way around, I don't know exactly how they would handle it, but I would recommend not doing it. Will we be able to view it again for employees who were not able to attend? Yes, we're happy to make this. Not only is the presentation available, this is being recorded, and it will be available for free on our website probably within a couple of days or so. I don't know exactly where it will reside, but it will be on our website. If you have trouble finding it, just send an email to me, and I will track it down and send you a hyperlink. I think I've answered all the questions, and if I haven't, please feel free to reach out directly to me. I'm happy to help any of you out, and I wish you well, and please stay safe.